Quam.
Lenny, thank you so much for your report today, to you and your colleagues. And it spurs in my thinking three thoughts. The first is I think your report really lays out the cost of doing nothing, and that the cost of doing nothing for all of us is very, very high economically and with regard to our competitiveness. And it reminds me of the particularly unique burden that small business plays in the midst of this. When I chaired the Healthcare Access Reform Commission in Minnesota, I was so struck traveling around rural Minnesota, where I'm from, and noticing that on any given street you could find a state of Minnesota office and a small business that employed people who lived on the same street, people who were absolutely neighbors, very similar lives, except if you were a state employee, you were part of a big pool, and if somebody in your office got sick, you didn't pay all those direct costs on your next year's premiums. But if you work for the small business, that's exactly what happened. And when you looked at these high costs and you look at the opportunity for everybody to have those sort of benefits of being part of a big pool and the stability that comes from that, it's a profound, profound difference. Secondly, I thought your analysis that really says, okay, we're a country with this kind of income profile and wealth, therefore where do we spend and where's the excess is very helpful. Because what strikes you so profoundly with that is that extra spending is not related to providing us with more health. And we've just come out of an election where much of the discussion was rightfully about, will our children be better off than we will be? And much of that was about, will they be better off economically than we will be? But what we know is that if nothing changes, our children will be the first generation that has a lower life expectancy than their parents because of our health. And to be spending so much money in excess of any other model that would be suggested by any other land, and to not be getting health benefits from them is really pretty profound. So thirdly, I'm always reminded in this of just the human costs of the circumstance that we're in. And to Carl's point, I'm frequently called by friends or associates who have good jobs with benefits, though oftentimes health benefits that are eroding right now, who really want to go start their own company. They have an idea, they have a business plan, they're right at the verge of doing that. And I get the call to say, is it a good idea for me to do that, even though my family will have to go without health insurance for a while to make that work? And I never have a good answer when I get that call. But we need a good answer for that, because we need it for our economy, and it's the right thing for people to be able to follow their dreams. One of the biggest challenges I think we're going to face in this healthcare debate is there will be a constant pull to compare where we are now to 93, 94. And I do understand that. However, the much bigger challenge is to understand where we are now, because the economic changes that are underway in this country last year and this year affect healthcare coverage profoundly and very, very rapidly. We saw a reduction in Minnesota, where we have quite good employer-based coverage, between 2007 and 2008, a 20% reduction in certain kinds of office visits amongst people who were insured because of greater levels of cost sharing. And as the economy shifts and people lose jobs and lose health care coverage, and their health care coverage has less there, we must understand how many people are really happy with what they've got. Because I would argue that that number is shrinking, and there are very, very few people in the small business and the emerging companies that we bank that feel happy about it. And our challenge will be to catch up with them in terms of our reform. Thank you.